Hi, and welcome to Project First Line for Dental Settings, Module 1, Body Reservoirs. In our agenda for this first module and also for our next module, we are going to talk about reservoirs of germs in a healthcare setting in general, and from our understanding of these reservoirs, we are going to single out the main reservoir in a dental setting. In our session today, we are going to concentrate on body reservoirs in dental settings and how understanding these reservoirs is important to build the knowledge and skills we need to recognize infection risks and to plan our infection control actions accordingly. In healthcare, we think about germ reservoirs in the human body and in the healthcare environment, which means we have body reservoirs and environment reservoirs. Body reservoirs, we have four main body reservoirs in a healthcare setting that are important for infection control. These are skin, the gastrointestinal system or gut, respiratory system, and blood reservoirs. For the environment reservoirs in a healthcare setting, we have water and wet surfaces, dry surfaces, dirt and dust, and devices. There are a few common pathways for germs. As the germs have reservoirs, they also have pathways to be spread from reservoirs in a healthcare setting. These pathways, or the main pathways, are touch, breathing in, splashes or sprays, and bypassing or breaking down the body's natural defenses. For instance, procedures and surgeries that require breaking a patient's skin can allow germs from the patient's skin to get into their body. Also, anything we do that involves touch, whether it is touching a person or things in the environment like any uh, medical devices, blood pressure cuffs, or in case of a dental setting, like any part of the dental unit, this can be a risk for germs to spread. Infection control actions at any one of the key points we just discussed can stop germs from spreading and causing infection. To make decisions about infection control, it is first important to think about where the germs are, which reservoir or reservoirs you are dealing with. Then, how the germs might get somewhere else, the pathway or the pathways. Then you can recognize the risk for germs spread to happen and do something about it by choosing the correct infection control action. In this session, we will focus on the body reservoirs that are important for infection control in a dental setting. There are other examples of body systems where germs live, but we are focusing on the four main body reservoirs that are skin, the gastrointestinal system, the respiratory system, and blood, and how we can relate this to infection control in a dental setting. Now let's use what we have learned about how germs spread to determine potential pathways within a dental setting. As you can see in this illustration, dental healthcare personnel are at the highest risk of germ spread because of the nature of dental procedures and the continuous contact with the patient's saliva and blood in almost any dental procedure. Also, as we look at the illustration, you can see that germs can travel in many ways, not only from the patient to the dental healthcare personnel, but also from the dental healthcare personnel to the patient. For example, if the dental healthcare personnel did not clean their hands properly, also Another example of how we can see germs spread in a dental setting is from inadequate disinfection of dental equipment, and this can lead to the transmission of germs from one patient to another. And lastly, an important reservoir for germs in a dental setting is the water lines of the dental unit. Improperly maintained lines can spread germs to both the patient and the dental healthcare personnel. Now that we have a background on how germs live and how they spread, let's start to think about the main reservoir of germs in a dental setting. The mouth contributes to the spread of germs and serves as a home for many germs. In the next few slides, we will discuss how the mouth is both a reservoir and also a portal of entry and exit based on its anatomy, its function, and its characteristics. Understanding the mouth is important to recognize risk and taking action in the dental setting, especially when we consider the mouth as a reservoir of germs. The mouth is particularly unique because it is part of both of the gastrointestinal system and the respiratory system. It is also common to have blood or saliva contaminated with the blood in the mouth. The mouth is considered a perfect reservoir for germs because it is open, warm, moist, and nutrient-rich environment that provides a welcoming reservoir for pathogenic and also the non-pathogenic microorganisms. Now that we have reviewed how the mouth is a great home for many microorganisms, let's look at how the mouth serves as a point of entry and exit for a variety of germs. With every breath, every bite of food, or sip of a drink, we introduce germs from our environment into our body. And the same goes for introducing germs from ourselves, from our bodies, to the environment. When a person sneezes, coughs, speaks, or even sings, respiratory droplets and germs that are in the mouth can spread to people and other surfaces around us. And also, since the mouth is connected to the GI system, gut germs can also exit the mouth through vomiting or in saliva. Now, what germs live in the mouth? The mouth has its own natural oral flora, or what we call oral microbiota, which means the bacteria and other microorganisms that exist within the mouth that are supposed to be non-harmful, non-pathogenic microorganisms. We often refer to these types of germs as commensal microorganisms. However, these same microorganisms, in certain circumstances, can cause both infections in both the mouth and the body and can become what we call opportunistic microorganisms. Other microorganisms in the mouth are the non-oral pathogens. These germs are not part of the normal habitat of the mouth, but they are able to live in the mouth. There are also blood-borne pathogens that can find their way into the mouth. In the coming slides, we will talk about each of these germs in greater detail. Let's start first with the oral microbiota. The oral microbiota, or oral microbiome, or oral microflora refers to the microorganisms normally found in the mouth. After the gut, the mouth is the second largest microbial community in the body, serving as a home to bacteria, fungi, viruses, and protozoa. Bacteria are the main component of the oral microbiota, and the most common type of bacteria that we can find in the mouth are Streptococcus mutans, Porphyromonas gingivalis, Staphylococcus, and Lactobacillus. How oral microbiota cause infections? Microorganisms of the oral microbiota are generally not harmful, non-pathogenic. However, sometimes microorganisms can become harmful or pathogenic. We see this with a common bacteria found in the mouth, that is called the Streptococcus mutans, which becomes pathogenic when there is a sugary environment, causing the most common dental infection, which is dental caries. Other infections that can be caused by oral microbiota include periodontitis and infections to adjacent structures such as tonsillitis. Evidence and many studies are linking the role of oral microbiota in systemic infections, particularly in people with weakened immune systems. For example, a patient with heart valve issues had a major dental procedure, and due to their high risk of developing bacteremia, the oral infection led to bacterial endocarditis. Another example is a patient with periodontitis. The bacteria that caused the periodontitis was aspirated into the lungs of the patient and led to what we call aspiration pneumonia. Oral microbiota causing pneumonia is more common to see also in patients at intensive care or those on ventilators when they have poor oral hygiene. Now let's increase our understanding for the mouth as a body reservoir with this question. How many microorganisms do you think are there in an adult's mouth? The adult mouth has approximately 700 species of microorganisms that are predominantly bacteria. On average, there are 50 to 100 billion bacteria in the mouth. This is a very important fact to remember so that we can understand the mouth as a body reservoir. Now let's talk about the second type of microorganisms in the mouth. The first type was the oral flora or oral microbiota. Now let's talk about the second type, which is the non-oral pathogens in the mouth, which are viruses and bacteria that infect other parts of the body but are found in saliva. Some examples of these germs include SARS-CoV-2, or the virus that causes COVID-19, respiratory syncytial virus, or what we refer to as RSV, rhinovirus, or the virus that causes common cold, influenza virus, or flu virus, Epstein-Barr virus, mononucleosis, or mono, or what is common to called kissing disease, type 1 herpes simplex virus, or the virus that causes cold sores, group A streptococcus bacteria or strep throat, cytomegalovirus, which is a risk during fetal development, Mpox virus. Evidence is still not clear here if the virus can be detected in saliva alone or only when there is oral lesions for the patients. The virus was detected in the saliva of patients, but they had also lesions in the mouth. So it is still not clear if the virus can be found even if there is no lesions in the mouth. So these are examples of some of the non-oral pathogens that we can find in the mouth. Now let's talk about the non-oral pathogens pathways. These non-oral germs spread through saliva or respiratory droplets when the patient coughs, sneezes, or talks. The germs can spread through splashes and sprays when using dental equipment in the patient's mouth, such as a high-speed handpiece or an ultrasonic scaler. Germs in these droplets can be spread through the air and either breathed in or come into direct contact with the mucous membrane of the dental healthcare personnel, as for example, their eyes. Spread through touch can serve as another pathway for a germ to travel from saliva or an infectious oral lesion to a dental healthcare personnel, especially if proper precautions are not followed. As an example, a dental healthcare personnel that has not donned gloves could come in contact with the herpes simplex virus of the cold sore of the patient and get what we call herpetic wetlow or cold sore lesions on their fingers. So now we talked about oral flora, non-oral pathogens in the mouth. Now let's talk about the other types of germs that can be found in the mouth, which is blood-borne pathogens. Blood exposures are an important infection control concern in a dental setting because blood and saliva contaminated with the blood are coming during almost all dental procedures. The most concerning blood-borne pathogens in dentistry are hepatitis B virus, hepatitis C virus, and the HIV or the human immunodeficiency virus. What are the blood-borne pathogens pathways? Now we will take a look at how germs can spread through blood. As we reviewed earlier, blood-borne pathogens are found in blood or blood-contaminated saliva. The most common pathways for these germs is by touching infectious blood with non-intact skin. The most common exposure are from punctures with contaminated needles or injuries by contaminated sharp instruments. Also, another pathway we can talk about for blood-borne pathogens is splashes or sprays contaminated with blood during dental procedures, especially those involving the use of a high-speed dental handpiece or ultrasonic scaler. These droplets can be breathed in or can enter through the mucous membrane of the face as that of the eyes. Also, these droplets can land on the hands of a dental healthcare personnel or on their gloves. Touching the eyes or the mouth with these contaminated hands can lead to the transmission of these infections. As we are reaching the end of our module for today, here are some key takeaways from the content we covered. Reservoirs are the places on and in our bodies and in the environment where germs live. Germs frequently spread between and among these reservoirs. The mouth is the main body reservoir in a dental setting. It is a reservoir for oral microbiota, non-oral pathogens, and blood-borne pathogens. Germs in the mouth can spread by touch, breathing in, and by breaking down or bypassing the body's defenses through non-intact skin or tissues. There are many evidence that are linking oral microbiota to systemic infections after dental procedures and from oral infections. Understanding where germs live and how they spread help us build and integrate effective infection control actions. Finally, even though we covered a lot today, There is still much more to learn. You can keep exploring these topics on your own using the resources on this slide. Project Firstline has a lot of products to help you learn more about how to recognize infection risks at work, where germs live in healthcare, and how germs spread. You can also follow Project Firstline on social media. There are also here some resources that are specific for dental settings. And that's it for our module for today. Thank you.